the SAFE program at St. Joe's is what we call a comprehensive violence program. So we have 5 currently certified sexual assault forensic examiners. So we're nurses who are specially trained to take care of victims of sexual violence. Over the years, we've expanded that to be able to take care of victims of domestic violence and human trafficking, various forms of abuse, and most recently, non-fatal strangulation. So we've become what we call the Comprehensive Violence Program. So the SAFE program at St. Joe's heavily relies on community partners to be successful. So Rape Response and Partners for Peace are big players in how we care for our patients. We hardly ever perform a sexual assault exam without an advocate at bedside, and we're one of the first programs in the state to have domestic violence advocates respond, and no other hospital in the state has a domestic violence agency able to respond at bedside. We would never be able to do the work that we do for our patients without the collaboration of all of our community partners.
As an agency, Penquist has a number of programs aimed at supporting victims of sexual assault, survivors of sexual assault. We couldn't do that work without St. Joe's SAFE program. These are nurses at St. Joe's that work with our Rape Response Services staff, and anytime there's a survivor in the hospital, our teams meet together to ensure that those survivors have the access to supports and resources that they need. The SAFE program was also critically important to the creation of a children's advocacy center at Penquist. This is a location where children who have experienced sexual assault can come and share their stories, have a comprehensive forensic interview, and then have access to resources and supports that they need to continue on with their lives. For the size of St. Joe's Hospital, I'm shocked, honestly, that they have 5 SAFE nurses and that the willingness to really engage and work together. I mean, this isn't just being in the hospital. Some of these folks are out in the community, going to colleges to educate students, athletes, going out to events and tabling things together. I mean, this is a true partnership, and also such a dedicated amount of time and commitment from the hospital.